Fear, a primal and adaptive emotion, serves as a protective mechanism, alerting individuals to potential threats. However, when fear becomes overwhelming and irrational, it can manifest as phobias, intense and persistent fears of specific objects, situations, or activities. Understanding the psychology of fear and phobias involves exploring the intricate ways in which these emotions manifest and impact individuals' thoughts, behaviors, and overall well-being. Evolutionary roots of fear. Survival mechanism. Fear is evolutionarily wired as a survival mechanism, enabling quick and instinctive responses to imminent danger. This adaptive trait has persisted across generations to enhance the chances of survival. Fight or flight response. The physiological and psychological responses associated with fear, such as increased heart rate and heightened alertness, are part of the fight or flight response, preparing the body to confront or flee from a threat. Formation of phobias. Classical conditioning. Phobias can develop through classical conditioning, where a neutral stimulus becomes associated with a traumatic or fearful event. Over time, encountering the neutral stimulus triggers a fear response. Observational learning. Observational learning, witnessing others' fear reactions, can contribute to the development of phobias. Individuals may adopt fears from role models or through social cues. Common types of phobias. Specific phobias. These involve intense fears of specific objects, situations, or activities, such as heights, acrophobia, spiders, arachnophobia, or flying, aviophobia. Social phobia. Social phobia, or social anxiety disorder, is characterized by an intense fear of social situations, interactions, or scrutiny, often leading to avoidance behaviors. Cognitive aspects. Catastrophic thinking. Individuals with phobias may engage in catastrophic thinking, anticipating the worst possible outcomes associated with the feared stimulus or situation. Selective attention. Phobias can lead to selective attention, where individuals focus intensely on the feared object or situation, amplifying the perception of threat. Behavioral responses. Avoidance behaviors. Avoidance is a common behavioral response to phobias. Individuals may go to great lengths to avoid encountering the feared stimulus, which can limit daily activities and negatively impact life quality. Escape behaviors. In situations where avoidance is not possible, individuals may resort to escape behaviors, attempting to remove themselves quickly from the feared situation. Systematic desensitization. Therapeutic approach. Systematic desensitization is a therapeutic technique used to treat phobias. It involves gradual exposure to the feared stimulus, paired with relaxation techniques to reduce anxiety and desensitize the individual over time. Counterconditioning. The process of counterconditioning replaces the fear response with a relaxation response, reshaping the individual's emotional associations with the phobic stimulus. Biological factors. Genetic predisposition. There is evidence of a genetic predisposition to phobias, suggesting that certain individuals may be more prone to developing irrational fears based on their genetic makeup. Neurotransmitter imbalances. Imbalances in neurotransmitters, particularly serotonin and dopamine, have been linked to anxiety disorders, including phobias. Impact on daily life. Impaired functioning. Phobias can significantly impair daily functioning, limiting activities, relationships, and career opportunities due to the pervasive fear and avoidance associated with the specific phobic stimulus. Quality of life. The impact on quality of life underscores the importance of addressing phobias through therapeutic interventions to improve overall well-being. Virtual reality therapy. Innovative treatment. Virtual reality therapy has emerged as an innovative treatment for phobias. This immersive approach allows individuals to confront and gradually overcome their fears in a controlled and therapeutic environment. Exposure therapy. Virtual reality exposure therapy involves simulating the feared stimulus, providing a safe and controlled setting for individuals to confront and manage their phobias. Cultural and environmental influences. Cultural variation in phobias. The prevalence of specific phobias can vary across cultures, influenced by cultural beliefs, practices, and environmental factors. Learned responses. Cultural and environmental influences contribute to learned responses and perceptions of threat, shaping the development and expression of phobias. Comorbidity with other disorders. Anxiety disorders. Phobias often coexist with other anxiety disorders, such as generalized anxiety disorder or panic disorder, amplifying the overall impact on mental health. Depressive disorders. The chronic nature of phobias and their influence on daily life can contribute to the development or exacerbation of depressive disorders. Treatment approaches. Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is a widely used approach for treating phobias. It focuses on challenging irrational thoughts and behaviors associated with the phobia, promoting healthier coping mechanisms. Medication. In some cases, medications such as selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines may be prescribed to alleviate symptoms associated with phobias. Understanding the psychology of fear and phobias involves recognizing the intricate interplay between biological, cognitive, and behavioral factors. From the evolutionary roots of fear to the innovative treatment approaches in modern therapy, exploring the multifaceted nature of phobias provides a comprehensive perspective on these often debilitating conditions.